are back with Dr. Sierra Windsor, and we are continuing our series on mold. Lots of people have questions about mold. Lots of people have questions about mold illness. We did a mold symptoms video. Today we're going to talk about diagnosis. Like if you think mold might be contributing to your symptoms, how is it that we know that mold is causing your problem? So if somebody has, like, if they think that mold is making them sick, like, what do we do? Do we test the person? Do we test the house?
We test everything.
How do we just licking the walls? Like, what do we do?
Yeah, it's a good question. There's a couple different ways to approach it depending on, I guess, like someone's specific case, and also circumstantially, right? If like you have mold in your workplace, there's a lot more repercussions to testing a building, right, than testing you. So it really depends on, do you own your house? Do you rent? There's so many nuance and factors in there.
Or even your workplace, like you said.
Exactly.
Yeah.
And I will say that I always like to make sure we test for everything else first, if possible, in terms of other conditions that can present very similarly to mycotoxin illness, like MCAS, or lots of these other things that could be going on before opening the can of worms, if possible. But if you're like, yep, it's the history is making sense, their symptoms are very much so tied to a location and a building, it makes a lot of sense to test. Basically, you can test, if you want to test a person, you would test with a urine mycotoxin test. Is the best, most sensitive way to test. I personally don't believe that testing antibodies in blood is really clinically useful. I think some providers do, but we can disagree on that.
And these are antibodies to specific types of mold. So this
Correct.
would be like an IgE antibody to mold, or an IgG. Okay.
Mm-hmm.
So that's not as helpful. Why is that not as helpful?
I don't find it as helpful because it's not giving you any quantifiable burden or toxin load in the body. It's kind of telling us your body was exposed at one point, your body made an immune response, which some would argue is the proper thing to do. And antibodies take a really long time to change. So we have no idea, is that a current exposure? Is that a past exposure? Like, what does this mean really?
That's like the argument for EBV. It's like,
exactly.
If you test antibodies for EBV, everyone's been exposed to EBV in theory. So it could be just a proper immune system response versus like an active EBV infection or reactivation.
Very similar, right? Like we probably are all exposed to mold. It's in our ecosystem.
Yeah.
So urine mycotoxin testing is the current best way to assess someone, and that's basically like collecting first morning urine, because these toxins that are from the mold species that you've been exposed to are excreted because your body does a good job of detoxing them, and we can measure them in the urine.
And we talked about mycotoxins last time. So these are like things that mold produce that can be airborne, they can be physically touching something.
Correct.
And then they get into our body and we can hold on to them, and then we excrete them through our urine usually. Okay.
Correct.
So urine mycotoxin testing, how do you get that done?
That's a good question. It's not cheap, unfortunately. It's the downside. But I believe there might be a couple direct-to-consumer test options. I personally do like more the provider ordered and through that avenue. So there's a couple different brands that offer this testing. And then the biggest question, of course, to decide with a provider is whether you want to do it provoked or unprovoked. And there's a lot of back and forth amongst the functional medicine world about this idea.
What does that mean? Like, what would be a provoked mold mycotoxin test?
So to provoke a test, you would take glutathione for several days beforehand, and glutathione is a big antioxidant in our body, but also has this unique ability of pulling mycotoxins out of stored fatty tissues. And so if you wanted to make sure that you were catching them, you would want to pull them out first, and so we know there would be more being flushed out in the urine.
So it would be provoking a test would be maybe a good representation of how much we're storing in our cells. Maybe not what we're actively being exposed to.
Correct. And that's kind of how I frame it with patients too. Like I usually err on the side of provoking a test rather than not, because if it's there, it's there. But if they are currently living in mold, they might not need to provoke a test, right? If you have an adequate amount currently, being ingested and being removed. So it's kind of up to you to decide, because some people who are living in mold would not tolerate glutathione very well. They might be really sensitive to it because it's going to pull out so much more, and they might feel like crap. So kind of up to the clinician and the patient to decide.
Got it. Okay, so if you're actively living in mold, then you don't want to provoke. You want to get an unprovoked test, and that will tell you kind of actively how much you're being exposed to. So maybe you've been previously exposed to mold and you think it's still affecting you. A provoked test would probably be a better idea, given like how much you might be storing in your body and you won't feel as sick.
Correct. That's
Okay.
usually how I think about it. A lot of mold specialists will always just err on the side of provoking because I'd rather find it than not. So it depends.
Yeah. And isn't there an argument that could be said that if you provoke someone who has stored mycotoxins, that everyone in theory has some form of stored mycotoxins, and that
True.
And that we could be releasing them, and it doesn't necessarily mean it's making your symptoms worse.
Potentially, yes. Yeah. So there's nuance on both those sides.
Yeah, so it's challenging.
Yeah.
Okay. Well, so if so someone can potentially do a mycotoxin testing. That can be run through most physicians, but they usually have to be done out of pocket, correct? Like insurance doesn't often cover them.
Mm-hmm.
Okay. I've had some patients too who have had like active insurance claims for mold, and even then they still won't cover the mycotoxin
I have
testing.
seen that as well.
Or what if you wanted to get your house tested? Like, what if you owned your house and you think it's in a place that you're living? What are some good options for testing your house?
There's a lot of options, ranging from a cute little dog that will come sniff your house, which I love. I love the Seattle mold dogs.
I like dogs are like the Parkinson sniffing dogs, the mold sniffing dog. It's pretty wild.
Yeah, it's amazing. But I will say I had a patient recently that they were booked out very far, so maybe not the best choice.
Right.
So that's an option. In terms of more like you testing your home options, the gold standard by far is to have what's called like an URMI testing done, where they come and take air samples and they look in the walls and take inner wall air samples. It can be very, very expensive.
Yeah.
So there's a couple nice ways you can test before that and kind of be like, okay, do we need to spend the money for that kind of testing? Let's like screen first.
What are some of those screening tests that people can do ahead of time before they do an URMI test? And that's ERMI.
Correct.
Okay.
Correct.
So what are some other easier tests that they can potentially do?
Yeah, so there's a couple ranging cost options. The most affordable option is literally just to get, can we say company names?
Yeah. This isn't CE credits.
Great. It's a company called Immunolytics that does really affordable. Basically, they mail you little petri dishes and you set them around your house and you leave them open for a certain amount of time. And you make sure your HVAC is running so that you have, if there's mold hiding in the tunnels, it comes out, and basically you let it sit for an amount of time, you mail it in, and they will tell you what's on it. It's a nice cheap screening. I think it's like a couple bucks per dish.
Nice.
Super cheap way to do it. Not the gold standard by any means, but if that's positive and they find something concerning, maybe okay, maybe then we'll move on to the next level, which is there is an URMI test that's like a duster, kind of like a Swiffer duster.
Yeah, we talked about it a little bit last time.
Yeah, I like this one a lot. It's like $249, so still pretty affordable compared to having someone come test your house. And basically, you just like dust all the surfaces and then mail it in, and they see what they can find, which is a nice option as well.
Great. Now, what would you recommend for people who really, really suspect they have mold, and some of these kind of preliminary tests come back negative? Do you think that is pretty definitive that they don't have mold? Or is it possible that some of these cheaper options might have higher rates of like false negatives?
I would assume probably the latter, in terms of like if we know they're having symptoms and also like other family members are having symptoms, it's very much so like a location, then it's probably worth having an official URMI test done, where they even like put cameras in the walls. Like there's a lot of people that do home mold testing that are not very thorough. They just look around, they're like, yeah, we don't see anything, and make a couple notes. Like, no, you need to get in the attic, you need to look in the walls. Like if you're gonna do it, you want to know for sure.
Well, and also because mold can be microscopic organisms, and we can't always see them with the naked eye.
Correct.
Yeah. I actually remember when we were buying our house, they were like, no, there's been no water leaks, and our inspector came through with this like crazy light filtration thing, and there was like, nope, water leak here, it was,
wow.
Yeah, so there's like lots of cool ways to do it. All right, so you can test your house, you can test yourself. Those are the best options. But we still don't necessarily know if the mold is causing our symptoms per se. We just know that maybe we've been exposed to it, maybe we've been exposed to it in the past. So we have to kind of decide on whether or not we're going to treat it. Correct? So our next video is going to talk about, like, what do we do then? So if we think we've been exposed to mold, the mycotoxin test comes back positive. Maybe the home or work test come back positive. I have had patients take petri dishes to work.
Yeah. Your work
If
doesn't like that, turns out.
what's that?
Your work doesn't appreciate when you tell them there's mold.
Generally not, no. So we're going to talk about the treatment options and then how to be able to do some of these treatments safely and efficiently to see if whether or not the symptoms are created by the mold. Great. Thank you so much for doing this. So we'll be back. We'll talk about mold treatment.